Assalamualaikum warahmatullahi wabarakatuh. Let me introduce ourselves. We are from Group 1. Myself, Nadine Augusta Gymnastiar, as a primary nurse.
I am Mandini Mustikasari as observer.
I'm Aulia Aini as a family patient.
I'm Muska Jawiya as patient.
I'm Mariana Baskara as staff nurse.
Good morning. Today we will observe discharge planning for Mrs. Richard Wiaulia, also known as Mrs. Richard, a 32 years old patient in the psychiatric ward diagnosed with paranoid schizophrenia. She was admitted on May 1, 2026 after experiencing auditory hallucination. Excessive suspiciousness, social withdrawal, and disturbed sleep pattern. During hospitalization, the patient frequently talked to herself and reported hearing voices telling her to avoid and isolate herself from other people. After receiving treatment with antipsychotic medication, psychosocial therapy, and therapeutic communication, her condition gradually improved. She is now calmer, more cooperative, able to communication appropriately, and the frequency of hallucination has decreased. In this session, Nurse Nandin as the primary nurse and Nurse Raihan as the staff nurse will provide discharge planning using simple and therapeutic communication. They will explain the patient's current condition, medication, healthy lifestyle, home care, warning sign of relapse, and follow-up schedule. Aulia, as the family member, will also participate in this session to support and assess Mrs. Richard during home care after discharge.
Good morning, Mrs. Richard and Mrs. Aulia. So how are you feeling this morning, and did you sleep comfortably last night?
Good morning, nurse. Yes, I sleep better last night compared to before.
Yes, nurse. You look calmer during the night. That is good to hear, Mrs. Richard. So let me introduce myself again. I am Nurse Nandi, the primary nurse who will cut today's session for discharge planning session. And this is Nurse Rehan, the staff nurse who will assist in providing education regarding home care.
So good morning, Mrs. Rista and Mrs. Owl. It's nice to meet you both this morning.
Before we begin, I would like to verify the patient identity. So for safety purpose, is your full name Richard Wiaulia, also known as Mr. Richard, born on March 15, 1994?
Yes, that is correct.
Okay, alright, Mr. Richard. So today we will explain your current condition, medication that need to be taken at home, healthy lifestyle recommendation, warning sign that should be monitored, and your follow-up schedule after discharge. So the purpose of this session is to help maintain your condition and prevent relapse. Are you and your family willing to participate in this session?
Yes, I'm willing.
Yes, nurse, we are ready to listen.
Mrs. Rista, during your hospitalization, your condition is showed a significant improvement compared when we first admit. You now appear calmer, easier to communicate with, and more willing to interact with people around you.
Yes, nurse. I feel comfortable and calmer now.
That's good to hear. How about the voice you used to hear before? Do they still appear frequently?
Sometimes they still appear, but much less often than before. I also try to distract myself when they come.
That's very good improvement, Mrs. Risa. So it means you are beginning to recognize and manage your symptoms. However, schizophrenia is a condition that still requires regular medication and routine follow-up to prevent relapse. Is there still a possibility that she may relapse at home, nurse? Yes, relapse still occur, especially if the patient does not take the medication regularly, experience excessive stress, lack of sleep, or skip follow-up appointments. That is why family support is very important in the recovery process. Alright, nurse, we will supervise and support her at home, nurse. Okay, next we will explain the medication that Mrs. Richard needs to continue at home, so please pay close attention.
So the first medication is risperidone 2 mg. This medication should be taken twice a daily in this morning and night after meals. Risperidone helps to reduce hallucination, excessive suspicion, thought, and help stabilize emotion and thinking pattern. Some possible side effects include downsize, dizziness, dry mouth, and increased appetite. If this side effect become a severe or interfere with a daily activity, you should consult the doctor during follow-ups visit.
If I already feel healthy and calm, may I stop taking the medication?
No, Mrs. Rizja, the medication should not be stopped without the doctor instruction. Many patients feel better and stop taking the medication, but eventually their symptoms return and their condition relapse. Therefore, it is very important to continue taking the medication as prescribed.
So in addition, you are prescribed Therapeutic 2 mg which should be taken daily after meals. This medication helps to reduce side effects such as muscle stiffness caused by antipsychotic medication. Possible side effects include a dry mouth, blurred vision, and constipation. To help reduce this effect, we recommend to drink enough water every day.
What should we do if she forgets to take her medication? So family members can help remind by setting alarms or preparing a daily medication box to ensure the medication are taken regularly.
Besides taking medication regularly, maintaining healthy lifestyle is important to keep Mrs. Rizja's condition stable at home.
For diet, Mrs. Risa is encouraged to eat balanced and nutritious meals such as vegetables, fruit, protein-rich foods, and drink water every day to maintain overall health.
So please reduce excessive coffee consumption and avoid alcohol and smoking because they may affect both physically and mental health and may also trigger sleep disturbance.
What about daily activity, nurse? Am I allowed to help with household chores?
Of course, Mrs. Rizja, you may gradually perform a light activity such as a morning walk, like exercise, sweeping, or helping with the household tasks to keep your body active and mind relaxed.
You may also need to maintain a good sleep pattern, so try to sleep for about 7 until 8 hours every night and avoid staying up late because the lack of sleep may trigger relapse symptoms.
If she suddenly talks to herself again or becomes restless, what should we do, nurse?
For family members, so remain calm and avoiding scolding or arguing with the patient. So stay with her patiently, speak calmly, speak gently, help distract her attention, and make sure he takes her medication regularly.
The family should also create a comfortable and peaceful home environment while avoiding excessive conflict or stress.
For follow-up care, Mrs. Rita is scheduled to visit the Psychiatric outpatient clinic on May 16, 2026. This was according to the doctor recommendation.
Routine follow-up visits are very important to monitor patient progress and evaluate whether the medication remains appropriate or need adjustment.
And what worrying signs should we watch for at home nurse? So please bring the patient to the hospital or healthcare facility immediately if warning signs appear, such as frequently hallucination, aggressive behavior, refusal to take medication, continuous insomnia, social withdrawal, or disorganized speech.
So in emergency situation or the family need assistance, you may contact the psychiatric clinic or come directly to nearest hospital.
In this session, I would like to make sure that all the information has been understood properly. So could you please repeat what will be done at home?
I need to take my medication regularly, maintain a healthy sleep pattern, recovery, and attend follow-up appointment as scheduled.
You need to remind her to take medication, monitor relapse sign, and continue supporting her at home.
Very good, Mrs. Rizja and Mrs. Ao. You have to understand and explain her well.
Do you still have any question before going home?
No, nurse, the explanation very clear and helpful.
I also understand it better now. Thank you, nurse, for the explanation. Alright, thank you for the cooperation during the hospitalization period. So we hope Mrs. Rizja continues to recover and remains stable at home.
Please stay motivated and continue the treatment, Mrs. Rizja. Do not forget to take your medication regularly and attend to follow-up appointment.
Yes, nurse. Thank you very much for your help.
And thank you, nurse, for the care and education. Welcome, Mrs. Rizja and Mrs. Alia.
Have a good day and stay healthy.